So, good afternoon ulit. So, part 2 na tayo ng lecture natin. So, our lecture is about tissue nematodes. So, ang i-discuss natin is Parastrongylus, Trichinella, and Toxocara. Okay, so Parastrongylus or uh, pre Parastrongylus cantonensis. So, previously classified under genus Angiostrongylus. So it is described by Chen in 1935 from domestic rats. So they normally live in the lungs of the rat. So thus the common name is the rat lungworm. So they can cause eosinophilic meningoencephalitis in man. Okay, so first human infection, Nanocha in Taiwan, 1945. So the adult worm is pale and filiform. So yung male yung size niya is 16 by 22 millimeter by 0.25 to 0.35. It has a well-developed caudal bursa, which is kidney-shaped and single lobe. So female, so larger siya than the male, and it has uterine tubules which are wound uh, spirally around the intestine. So meron siyang barber pole uh, pattern. So remember, a single female worm can lay up to 15,000 eggs daily. So this is the Parastrongylus worm. So note the yung long spicules. So ito. So indication na it is a male worm. So Parastrongylus adult worm that is recovered from the vitreous humor of the human patient. So it has a small copulatory bursa. So yan. And supported by bursal rays. So ito. Okay. So the ova uh, elongated and it has delicate hyaline shells. Okay. And this is a picture of a first stage larva which is found in the lungs of the rodent host. It has a distinct knob near the tip of the tail. So here is the uh, life cycle. So remember, rats, sila yung definitive host. So rats are infected through penetration of the third stage larva. So ayan. They penetrate the stomach and travel into the bloodstream and reach the CNS. They undergo maturity and the young adult migrates to the pulmonary arteries and complete their development. In 2 weeks, the adults start, uh, uh, the female adults start laying eggs. So eggs hatch and first stage larva penetrate the respiratory tract and reach the oropharynx where they are swallowed and expelled in the feces. So it takes 6 to 8 weeks from infection before the rat excretes the first stage larva. Okay? So, yung first stage larva is the infective stage of the molluscan intermediate host. And they mature to become the third stage larva. So, ano yung mga intermediate host? So, yung giant African snail or the Acanthina fulica, Hemiplecta sagitifera, and Helicostyla macrostoma. So, the third stage larva, it is the infective stage to humans. So humans are incidental hosts. So they have pointed terminal projection at the end of the tail. Okay? So, ulit ko lang, humans are incidental hosts. So transmission is usually attributed through ingestion of the raw mollusk intermediate host, ingestion of contaminated leafy vegetables, ingestion of the parenthenic host, and drinking of contaminated water. So when the humans get infected, the larvae pass through the stomach and they enter to the circulatory system, and they migrate to the brain, spinal cord, and occasionally to the eye chamber. And remember, larva lang yung nakikita sa human and they do not develop into adult stage. So ano yung mga incubation period is 6 to 15 days, but they may vary from 12 to 47 days. So chief complaint usually is acute, severe, intermittent, bitemporal, or occipital headache. Signs and symptoms is neck stiffness, blurred vision, fever, nausea, body pain, confusion, and disorientation. Uh, Prognosis is usually good, and in most cases, the disease is mild and no hospitalization is required. In some cases, yung postmortem findings or autopsy findings, meron tayong manonote na leptomeningitis and ventricular dilation. Okay? So, diagnosis difficult because the primary site is the brain. So, kailangan natin ng combination of the history, exposure, and travel history, physical examination, laboratory findings, psychological test, and diagnostic imaging. So, CBC, high proportion of eosinophils, and the CSF analysis. There is increase in eosinophil count and protein, and the glucose is normal. And first, we must rule out other infection first. Okay? So for the CT scan, may mga nanonote tayong non-specific cerebral edema and ventricular dilation. Sa MR findings, may hyperintense T2 signal lesions, and gumagamit din tayo ng PCR or polymerase chain reaction. So no anti-helminthic treatment is recommended at present, but ito yung ginagamit sa ibang studies, mebendazole and albendazole, and symptomatic treatment. So gumagamit tayo ng lumbar puncture and analgesic. So how can we prevent and control it? So awareness and education on proper eating habits and food preparation and hand washing. Okay? So next, Trichinella spiralis. So there are 8 recognized species and 3 genotypes under the genus Trichinella. So Trichinella spiralis, or the common name, is the mussel worm. So it's the most common important cause of trichinosis in human because it is the most adapted to domestic and wild pigs. Okay, so the adult male, ito yung size niya, maliit lang siya. It has a single testis located near the posterior end of the body. Yung female naman, it has a single ovary and it has a oviduct, coiled uterus, and vulva. So kung titignan nyo yung size, mas malaki yung female kaysa male. Okay, for the larva, so ito yung size niya, and it has a spear-like burrowing anterior tip. And reproductive organs are not fully developed. So, ito yung sa tissue sample ng Trichinella. Okay? So, example of encysted larva of Trichinella in muscle tissue. Okay? They are stained with H&E. So, humans, rat, dogs, cat, pigs, bear, foxes, and other carnivores serve as both the final and intermediate host by harboring both the adult and larval stage. Infective larvae are usually encysted in the muscle fiber of the host. Okay, so trichinellosis is caused by the ingestion of undercooked meat containing encysted larvae, the Trichinella species. So after exposure to gastric acid and pepsin, the larvae are released from the cyst and they invade the small bowel mucosa where they develop into adult worms. So the lifespan in the small bowel is usually about 1 month or 4 weeks. And after 1 week, the females release the larva and migrate to striated muscles where they encyst. So usually, pag light infection siya or less than 10 yung larva, they are asymptomatic. For the moderate infection, gastroenteritis, diarrhea, abdominal pain, and for the severe infection, so 1,000 to 3,000 larvae. So the severity depends in the infection or yung dami ng larva. Okay? So clinical condition is divided into three phases. So the enteric phase, so it is the incubation and intestinal invasion. The invasion phase, the larval migration and the muscle invasion, and the convalescent phase and the encysment and encapsulation. So enteric phase, so they resemble into food poisoning. So meron abdominal pain, diarrhea or constipation, malay, and nausea. Sa invasion phase, so nandito yung meron tayong metabolic reaction, immunological reaction, and pathological reaction. So, andito na yung eosinophilia, fever, chills, headache, paralysis, and gastric hemorrhages. So, sa invasion phase, so pwede tayong magkaroon ng cardiac complication. So, ito yung manonote natin, pericardial pain, tachycardia, ECG abnormalities, and congestive heart failure. For neurological problems. So, pwede tayong magkaroon ng subacute cortical infarcts, meningitis, and ocular disturbances. So, convalescent phase. So, fever and weakness start to abate. So, full recovery is expected because trichinosis is self-limiting. Prognosis is good, especially in mild infection. However, morta ah, and mortality is low except dun sa mga cases na merong heart failure and encephalitis. So, low-grade or absent peripheral blood eosinophilia is an indication of poor prognosis. Okay? So, ito yung mga sinasabi kong symptoms. So, pwede tayong magkaroon ng facial and periorbital edema, abdominal pain, and larval encysment in the muscles. So, for the definitive diagnosis is demonstration of the larva in the muscle biopsy. So, gumagamit din tayo ng mga non-specific lab tests. So, muscle enzyme determination and total IgE determination. And gumagamit din tayo ng mga serological tests. So, mga ELISA and latex agglutination technique. Okay? So, ito yung may ginawa yung WHO na table. So, para ma-determine natin kung suspected case, highly probable case, and confirmed case. Okay? So, for the treatment, drug of choice is mebendazole and albendazole. Treatment cycle may be repeated 5 days after the initial cycle in case of severe infection and gumagamit tayo ng supportive treatment. So, human trichinosis occurs wherever the meat is a part of the diet. So, it is primarily a zoonosis. So, humans get infected after ingestion of improperly cooked or eating raw meat from infected animal. Infection is usually maintained in a pig-to-pig or pig-to-rat-to-pig cycle. Okay? So prevention and control can be done by proper health education, and properly cooked meat and freezing can also kill the larva. Okay? So next is the toxocariasis. So it is a zoonotic disease. So meron tayong two species. So Toxocara canis sa dogs and Toxocara cati cats. So when humans ingest eggs, they penetrate the intestinal wall and migrate to the liver. So ito yung size niya. So mas malaki ulit yung female. They have 3 lips on the anterior end of the worm and they possess large spear-shaped cervical alley. So yung female nematode can produce 200,000 eggs. Okay? So for the larva, so ito yung ano niya, size. So it has a straight esophagus extending about a third of the body length. So yung ova, color gold, spherical to slightly pear-shaped, thick-shelled, and it has a pitted surface. So embryonated eggs, so they are the infective stage, resisting to freezing. They are usually resistant to freezing, moisture, and extreme pH levels for at least a year. So humans are accidental hosts. They become infected by ingesting eggs from the contaminated soils. The eggs hatch and they release larvae that penetrate the intestinal wall and are carried by the circulation to different organs. So larvae do not develop into adults uh, in the human host. So meron siyang 2 life cycles. So meron siyang direct and indirect life cycle. So humans are accidental hosts who became infected by ingesting infective eggs or undercooked meat. So after ingestion, uh, the eggs hatch and they penetrate, the larvae penetrate the intestinal wall and are carried to a variety of tissue. Okay? So, meron tayong 3 clinical forms. So, the visceral larva migrans or the VLM, the ocular larval migrans or the OLM, and the covert toxocariasis. So, VLM and OLM can be presented as independent clinical manifestation, but they can coexist. So, VLM, so there is migration and death of the larva in the different tissues, which can cause eosinophilic granuloma. So, common signs is wheezing, meron tayong manonote na bronchospasm, pneumonia, and respiratory failure. Liver enlargement, and meron din tayong necrosis. So, heart is infrequently involved, but ang most common problem pag may heart involvement is myocarditis. So, ocular larva migrans, they usually occurs in children. And yung common complaint is unilateral visual impairment with strabismus. Ang most serious consequence is the invasion of the retina. And yung covert toxocariasis, so patients are usually asymptomatic and less specific symptoms, and eosinophilia is less frequent. So, neurological toxocariasis, this is a case where larvae migrate to the brain, meninges, and may be found in the CSF and can cause encephalitis. And may produce solitary lesions. So, they can cause seizure and eosinophilic meningitis. So, the definitive diagnosis is the detection of the larva in the tissue. Fecalysis cannot be utilized because eggs are not produced or excreted. So, toxocariasis in human are difficult to diagnose because the symptoms are similar to other infection. So, this is a cross-section of Toxocara larva in liver tissue stained with HNE. So, biopsy is time-consuming and difficult to perform. So, yun lang ang cons ng detection ng larvas and ng definitive diagnosis natin. So, here is an example of a longitudinal section of Toxocara larva in the lung tissue. So, uh, uh, Here is a example of prominent granulomatous reaction. So, diagnosis, clinical and serologic test. So, gumagamit tayo ng ELISA, PCR, and Western blot. PCR has a good result using animal models, and Western blot has high specificity but unable to differentiate between old and new infection. Drug of choice is albendazole or mebendazole. So, gumagamit tayo pag may neurological toxocariasis and cardiac complication. Okay? Strategic antihelminthic treatment and proper washing of vegetables. So, yan yung mga control natin. So, for the reference, here are my reference. Thank you.